Today's date is July 22nd, 2014. We're here with Bonnie, who I videoed back in February, right?
Right.
And you came in to me with a lot of complaints, especially your knees and your shoulders. And you also told me you had some problems with energy and memory, right? Brightness of your mind.
Dizziness and a myriad of problems.
What's happened to the dizziness and your memory and your thought processes?
Well, today, right after this treatment, my memory I'm feeling bright, and my thought processes are working today. And in February, they just plain didn't work.
And you told me before we started the session that you felt that these are coming along slowly but surely every day, correct?
Very slowly, yeah. I was kind of almost discouraged and ready to say maybe this is not worth it. And then a couple weeks ago, that started making it. I could tell a big difference in my head.
Kicking in. Okay.
And yeah, I'm gonna keep doing this now.
Okay.
The knees has been from the beginning. It's helped. And then last week you did it in my shoulders, and my shoulders are really good. There's just no pain in my shoulders at all, and I can even sleep at night on them.
I'm happy to hear that. Let's see you get your shoulders over your head. Outstanding. You couldn't do that before.
Absolutely not. I would get like this.
Right. Okay. For the viewer, we've done ozone injections into your knees. That's called Prolozone, and we did Prolozone to your shoulders. One session on your shoulders helped dramatically. And when you first came in, I videoed you hobbling to the door, and we'll do that in a moment to show the viewer the change. And I also want the viewer to know you're getting IV therapy as well.
Yes.
You're getting oxidation therapy, ultraviolet and ozone, and you're getting chelation therapy.
Yes.
And
some oil.
Yes, essential phospholipids. And this is to help improve circulation. And these therapies don't work overnight.
No, I was a little disappointed, actually, to be honest. But I'm beginning to really, I'm beginning to tell there's a difference.
Right. They're not overnight. The idea is over time. I mean, it takes years to plug up your arteries, right?
Right.
It takes years for that to happen. You can't expect a miracle overnight. What we're trying to do is encourage your body to heal itself. And I can't sit here with my teeth in my mouth and say, I'm unplugging your arteries. But what we're trying to do is make an environment within your circulation so that your own body reverses what it did. And if it took 40 plus years to get there, well, I'm not going to be happy waiting 40 years to undo it, but we better be patient.
Yep, 4 months isn't all that much.
Not after 40 years, that's right. My mentors, who I consider some of the best people in the world, said, for every 2 years that you've been sick, give me a year, 50% of the time, to help undo it. And in your case, you're noticing a lot of improvement, not in 50% of the time, but less than 10%. You've been at this for 40 years, and it's only been 4 months, and now it's beginning to kick in.
Another thing I hadn't told you yet, but I'll tell the video. I can really tell a difference in my intestines with the raw food diet. If I stay on it, I'm working very well, and if I go off of it, I have a run to the bathroom problem.
Thank you for that. I teach eating living foods or raw foods. Now, I don't expect somebody to be 100% raw. What I'm trying to do is get you to eat 100% organic or close to it. 70 to 80% of what you eat should be food the way God made it, unaltered. And what you do with the remaining 20%, it can be meat if you want. And obviously you have to cook it, but no fast, fried, refined, or processed foods. And this has made a huge difference for you, yes?
It has when I'm sticking on it, and boy, when I go off, I can tell you the next day.
Okay, thanks. Can we see you walk to the door?
Sure. And I got up real easily without hanging on to anything. I couldn't get out of the chair without pushing myself.
Right, and you also were wobbling like this when we first saw you. So this is a wonderful improvement. And I may post this on YouTube?
Yes.
Thank you very, very much.
Okay.